I am Leonor, and I was there, before birth became a moment surrounded by doctors' white lights and controlled silence. Before pain could be measured, reduced, or interrupted, before giving birth was called a procedure. I was there when bringing a child into the world was a real risk, and when every woman knew deep in her chest that she might not walk away alive.
Today you speak of birth, plans, anesthesia, medical teams, safety, in the Middle Ages. To speak of childbirth was to speak of a gamble between life and death, between mother and child, between hope and resignation. It was not a rare event. It was not a calm celebration. It was feared, because almost every woman knew someone who had died giving birth, sometimes several. When a woman discovered she was pregnant, she did not think about baby clothes. She thought about survival. She prayed, asked for protection, promised devotion. She knew her body was about to be tested in ways it might not endure, and even so, there was no choice. Pregnancy was not planned. It was consequence. There were no tests, no ultrasound, no diagnosis. No one knew if the baby was well. No one knew if something was wrong. No one even knew if there was only one child. Everything was discovered at the moment of birth, and when something was wrong, it was usually already too late. Doctors rarely participated. Births were handled by midwives, older women, women who learned by watching, women who gathered experience, not diplomas. Some were skilled, others simply repeated what they had seen, but all of them worked almost blindly. There were no clean rooms, no sterilization. Births happened in dark chambers, smoky houses, wooden floors, dirty cloths, the same place where people slept, cooked, and became ill. Bacteria had no name, but they had effect. Women rarely lay down. It was believed that standing, squatting, or sitting helped the baby come out. Birthing stools were common. Chairs with openings in the center. The woman held onto someone or onto a rope tied to the ceiling. She sweated, screamed, begged, and no one had a way to stop it. There was no anesthesia. Sometimes ARBs were given, sometimes wine, sometimes strong alcohol. None of it removed pain. It only blurred it. Pain was not softened. It was endured. Contractions lasted hours, sometimes days. The body went beyond its limits, with no one knowing where that limit truly was. Every contraction could be the last. If the woman bled too much, if she fainted, if the baby did not come out, everyone in the room knew she could die. And there was no emergency surgery, no safe cesarean. There was only waiting. Breech babies, tangled cords, babies too large, common situations, almost no solutions. Midwives tried to push, turn, pull. Sometimes they used hooks. Sometimes they crushed the fetus's skull to remove the body, not to save the child, but to try to save the mother. And many times, they saved neither. Even when birth seemed successful, danger remained. Open wounds, dirty hands, torn tissue. What we now call puerperal fever killed silently. Days after birth, the woman began to shiver, develop fever, delirium. Then she died, without anyone understanding why. No one kept numbers, but everyone knew stories. A woman dying in childbirth did not shock. It brought sorrow and acceptance. It was seen as part of life, just like infant death. If the baby cried, there was relief. If it did not, they rubbed it, shook it, prayed. If it remained still, it was considered divine will. Few babies received real attempts at resuscitation. If the baby seemed weak, many midwives performed immediate baptism, even before cutting the cord, because dying unbaptized meant eternal condemnation. Saving the soul mattered as much as saving the body. There was no proper recovery. Within days, many women returned to work, in pain, bleeding, with crude stitches. Because the family had to eat, the body mattered less than collective survival. Women who survived carried physical memories, scars, chronic pain, complications. But above all, they carried memory. They knew that surviving once did not mean surviving again. Today, pregnancy is announced, photographed, shared. In the Middle Ages, many women hid their bellies as long as possible, not from shame, but from fear. Fear of attachment, fear of hope, because too much hope made loss unbearable. Miscarriages were common, stillbirths too, mothers cried. But rarely were there funerals. The world did not stop, life kept pushing forward, not from cruelty, but because stopping meant dying as well. Wealthy women had separate rooms, better sheets, sometimes doctors. Poor women gave birth wherever they could, on floors, in stables, in shacks. But the real difference in survival was smaller than you imagine. Medical knowledge was limited for everyone. Wealth did not defeat bacteria. Amulets hanging, symbols drawn on doors, herbs under pillows, religious relics near the body, all meant to ward off evil spirits, because when the cause is unknown, an invisible culprit is created. Men rarely witnessed the birth. They waited outside, praying, drinking, pacing. Some lost wife and child in the same night, and days later already had to consider remarriage, because children were labor, and a house without a woman barely functioned. No one asked if a woman wanted to be a mother. Being a woman meant becoming pregnant. Refusal was almost unthinkable. The female body was not seen as choice, it was seen as function. Even when everything went right, the experience left marks. Women developed fear of becoming pregnant again, but became pregnant, developed panic, but continued, because there was no real alternative. Few books speak of these women. Few names were recorded. Millions lived, millions suffered, millions died, without monuments, without statues, without memory. Not kings, not generals, not knights, but ordinary women, giving birth in dark rooms, bleeding, screaming, surviving, or not. History continued because they continued.
I saw them holding their bellies in silence. I saw hands gripping rosaries. I saw women saying goodbye to their husbands before entering the room, as if they knew, many of them knew.
Today you speak of choice, and that matters. You speak of pain relief, and that matters. You speak of safety, and that matters. None of it appeared from nowhere. Every advance was built on piles of bodies. You romanticize medieval motherhood. You call it simple, natural, pure. It was not. It was brutal, uncertain, frightening, and dangerous. Perhaps what is most astonishing is not the pain, nor the death, but the willingness to continue. To try again, to become pregnant again, to risk again, even knowing the cost.
I saw women give birth. I saw women die. I saw women survive. And if there is one thing I learned, it is this: the past never truly leaves, it only learns new ways to exist. If you wish to keep walking with me, there are still many stories you have never heard.